A tragic mom who took cannabis to ease her morning sickness developed serious mental health problems and later killed herself, an inquest heard. Polly Ross, 32, suffered from drug-induced psychosis after taking cannabis to stop a severe case of the condition during her second pregnancy. In July 2015, just over a year after the birth of her second daughter, she was killed after stepping in front of a train. Mrs. Ross died after telling medical staff at a mental health unit she was going to buy some cigarettes. Hull Coroner's Court, in East Yorkshire, heard Mrs. Ross had developed drug-induced psychosis after taking cannabis to stop symptoms of hyperemesis gravidarum, HG, the same condition experienced by Kate Middleton. Mrs. Ross told her GP, Dr. Daniela Mailsnasr, she had taken cannabis during her pregnancy after visiting the doctors suffering from postnatal depression. In a letter addressed to Mrs. Ross's psychiatrist, the GP noted the patient's psychosis had stemmed from illicit drug use, namely cannabis, taken during pregnancy. Dr. Mailsnasr said, "She had told me when she was pregnant with her second child that she was taking cannabis and magic mushrooms to help combat HG during her pregnancy, but she was no longer taking it." Professor Paul Marks, the senior coroner, questioned, "And does taking cannabis actually benefit those suffering from HG?" The doctor replied, "I can't possibly comment on that." Dr. Mailsnasr said alarm bells were ringing after Polly had told her she wanted to commit suicide on February 13, 2015. The inquest heard the GP had called in at her home to find her in a psychotic episode and Mrs. Ross was sectioned the following month. By March 18, Dr. Mailsnasr said Mrs. Ross was diagnosed with drug-induced psychosis following the amounts of magic mushrooms and cannabis she had been taking. The GP said she was then given risperidone to help battle the episodes. Mrs. Ross tried to take her life 3 times with self-harm and taking an overdose twice in a 3-month period. But the court heard she was allowed to discharge herself voluntarily following the last attempt to take her own life. Professor Marks said, "So after taking an overdose of 60 paracetamol tablets, Polly was allowed to just leave voluntarily." Dr. Mailsnasr said, "I can't comment on that because it is a hospital matter." But in May 2015 a psychiatrist in the community said psychosis was no longer a problem and she should come off the anti-psychosis drug risperidone. The translator was given help by a crisis team to give her a higher and intense level of support, but Mrs. Ross had refused them entry to her house in Driffield, East Yorkshire. Mrs. Ross died on July 12, 2015, by stepping in front of a train in Hull, East Yorkshire. Her death was instant, Hull Royal Infirmary consultant histopathologist Dr. Ian Richmond told the hearing. Mrs. Ross's devastated family feel badly let down following the lack of support given to her in her battle with mental health, a coroner heard. A statement from Mrs. Ross's Aunt Emma May, who cared for her during her final months, read, "With the right guidance, medication and support, Mrs. Ross could have made a full recovery. There should be systems in place to protect that life, especially because there are so many suicide attempts of postnatal women. I cannot understand why she was allowed to leave the hospital unit before she died." Polly clearly said many times that she would kill herself, many months before she did. "I feel that she posed a significant risk to herself, did not have sufficient capacity to make decision and more should have been done to protect and care for her." Mrs. Ross, who ran her own very good translation business in Paris, was described as an extremely intelligent lady and very driven in her own ambition, by Mrs. May. She was also described as frighteningly clever. She met her English husband Samuel Ross in 2011 in the French capital and the pair quickly married and had 2 daughters born in June 2012 and June 2014 respectively. The inquest, expected to last 3 days, continues. Samaritans, 116-123, operates a 24-hour service available every day of the year. If you prefer to write down how you're feeling, Or if you're worried about being overheard on the phone, you can email Samaritans at joe@samaritans.org.